do you have at this point what some call COVID-19 virus caution fatigue? What do you think? Let's talk about it today with healthy living specialist Dr. Matt Chalmers. Good morning, sir. Welcome.
Morning.
Are we having caution fatigue? Time to throw caution to the wind? Probably not a good idea, but sometimes fun stuff isn't always a good idea at the time, or seems like a good idea. It turns out to be bad. But what do you think?
You know, we're starting to see a lot of this fatigue, coming from multiple different areas. One of the biggest is that we're starting to get so much conflicting information. 6 weeks ago, the CDC, Fauci, the Surgeon General all said, if you're healthy, don't wear a mask, you'll be fine. Now they're all saying we should wear masks. People are just kind of tired of being forced to do stuff when they don't know if it's, accurate.
Well, I'll play devil's advocate to this extent here. I mean, even, some of them like Fauci, not being a young man, has never seen anything quite like this in terms of its depth and breadth worldwide and here in the U.S. So, I mean, they're being asked questions daily, trying to give the best response, but isn't it possible that, they're winging it a little bit too, and they were, until they had better data, better information, which could run counter to what they said prior. It's possible, right?
Oh, it's absolutely possible. I don't know if what we've learned about the virus in the past 6 weeks has changed our knowledge and our understanding of personal protection over the past, 50 years. But it is possible that, we might have learned something new. The idea that wearing a face mask that, you can smoke cigarettes through or you can vape through is going to protect us against the virus. I don't know how much accurate that is, but if we're going to do something to protect us, I guess this is better than nothing.
Okay, so what would you suggest otherwise?
At this point, when we start looking at the actual data, and we start recognizing that, most of the people in America are not having a big issue with this, especially the children. The biggest thing that I would want to do is get people back out into normality. One of the things that we keep worrying about is what's going to happen with our jobs and what's going to happen with, the adults, but no one's talking about the children. If you start looking at 3, 5, 7, 10-year-olds who were socially isolating against their will, they have no idea what's going on. We're actually causing tremendous amounts of psychological damage to these children because all they know is they had friends, now they don't get to talk to them, now they don't get to see them. And so it's very, very damaging to the children. So one of the things I'd want to make sure that we did was get these children back acclimated, back into some type of life with, some type of social circle.
What would that entail? I mean, kids have been part of Zoom classes, and they have been able to get together in smaller groups. Not large groups, but that's been a no-no pretty much for everybody. What would you specifically suggest?
A lot of people are not allowing, in a lot of states, in a lot of areas, are not allowing, children to go out and be part of sports. They're not allowing them to be part of, some of the summer camps. Obviously, school's been closed down, and lots of states are talking about not having school open back up in the fall. So I would want to make sure that we really diligently think that through and make sure that we're doing the best thing for the children with the data we have. You look at the data, and people under 20 years old are showing almost zero issue with this. So that would be something I'd want to look at.
Although the numbers have been trending lower on age group here, and there's been some suspicion by some experts, Dr. Chalmers, that the virus may be doing its own morphing here and becoming something that's less nasty in terms of death, but also perhaps spreading easier here during the summer months. And I mean that has been an area of discussion of late.
It is a big deal when we start looking at these higher instances of people who have the virus. But what we're forgetting is that the more people who catch the virus, the more people who have antibodies against it, the faster it burns out. The faster we actually reach naturally herd immunity, then this virus will start to kind of just go away naturally on its own. So the idea that people are catching it, getting over it, or catching it and having those symptoms is actually a really good thing. As long as the death toll starts dropping, we're really going in the right direction.
Well, it certainly has been dropping here in our state of Michigan, even as the cases have risen. Of course, that will bring the morbidity rate down, and it has, not substantially yet, but you would assume that at some point that will start falling steady. Still, this seems like something more than what some people called it early, just another case of the seasonal flu. It hasn't exactly been that. Dr. Matt Chalmers, our guest, healthy living specialist, he does a more holistic approach to looking at mind, body, and spirit. I appreciate you joining us today very much.
Absolutely, sir.
All right. Take care.